Hello, good morning. I'm Dr. Deepali Kashyap with Galleria Women's Health, and today I'll be talking about the birth control options or the family planning options. So, there are many different kinds available, and sometimes it can be confusing what to use, what not to, and what exactly are they. So, let's go over them. The most commonly, they are classified as hormonal and non hormonal. And when we talk about hormonal, the most common one, what we are describing, is combination of two hormones, estrogen in the form of ethinyl estradiol and progesterone as synthetic progestins. So the first one in that category is birth control pills, which look like this. So this pack contains combination of two kinds of pills. The most numbered are the hormone pills, and then the little ones, which are different color, are basically sugar pills or the iron pills. So they are supposed to be taken every day, and the gap should not be more than 24 hours. The second one among hormonal comes in a pack like this, and it is a patch. So you take out all the plastic shields, and then it is supposed to be used on a clean, dry surface, and we use it once weekly, and then you change it every 7th day for 3 weeks. And the 4th week, when we don't use it, that's when one gets a period. It is very important to get a good seal, because if it's not properly sealed, then the amount of hormone which is delivered is not done properly. The third one is NuvaRing. It comes in a pack like this, and it actually has a ring which looks like this. It's almost like a hair tie. It's very flexible, and you can easily put it in the vagina yourself. It can actually be left inside even during sex, or one can take it out if it makes them uncomfortable. But important thing is that it needs to be placed back within 3 hours. So all these three options, which is the pill, the patch, or the ring, they are pretty much the same thing. They have these two hormones, ethinyl estradiol and synthetic progestin. It's just a different way how we are putting the hormone in a body, either through a mouth or through the skin or through the vaginal mucosa. And the way they act is they prevent ovulation. So when there is no egg which is released, there is no pregnancy. The common side effects with these is changes in the menstrual pattern, bleeding. So there is a little bit more spotting for the first few months, or there could be headaches, change in appetite, breast tenderness. There are a few people in which we cannot use this. Now, who are those? So anybody who is at risk of developing more clots in their legs or heart or brain should not be using this. And the reason is because the estrogen itself is thrombogenic. What that means is it also increases our tendency to develop clots. So then we do not want to use anything which increases that process. So anyone who is older than 35 and who smokes, anybody with seizures, anyone who has had stroke, heart attack, or who has had clots, like we call it pulmonary embolism, or DVT, like clot in the legs or in the lungs, should not be using this. Then anyone who actually has a personal history of breast cancer, or basically cancers responsive who respond to estrogen, even liver cancers, or anybody with undiagnosed vaginal bleeding, because that also could be a sign of cancer, should not be using these. Also, when we talk about the patch, anybody who has a BMI of more than 30, BMI is your body mass index, which is calculated based on weight and height. If it is more than 30, should not be using the patch. The second category among the hormone methods is the progestin only methods. So there are some people who cannot use estrogen for different reasons. Some of them can still use hormonal method, but only which contains progesterone, not estrogen. So the first in that category is the pill. So it looks pretty much the same way like a conventional pills. This one also has two different colored pills, and this really needs to be taken pretty much at the same time, because the level decreases and they're not very effective if they're not taken within 24-hour range. The second in this category is the shot. It's also called Depo shot, birth control shot, progesterone shot. So this also has synthetic, it's a progestin which is given every 13 weeks. So the advantage is that somebody doesn't have to take things every day. The side effects, especially with this, is weight gain on an average of about 5 pounds a year, and it also causes bone loss. The bone loss is reversible, so once you stop using it, you can gain some of that bone back, but there could still be some residual bone loss. Third option among these is called Nexplanon, or the rod. It looks like this. So this is a single rod which is placed subdermally in the arm, right here in this area, and it contains the hormone etonogesteron, which is the same thing which is present in the ring, and it is released every day in a constant manner. It's good for 3 years. So again, the advantage is you don't have to take something every day, and it is very popular among younger girls because nobody can see it, it's there, but you can feel it, and it's good for 3 years. The fourth one in this category is IUD, or the intrauterine device, the levonorgestrel intrauterine device. The IUD is wrapped with this hormone which is placed inside the uterine cavity, and it is released every day in constant manner. There are 4 levonorgestrel IUDs in the market today, or the synthetic progesterone IUDs. The first one which came out was Mirena. It had 52 milligrams, and it was released every day for 5 years. The second one that came out is called Kyleena. It is much smaller in size than Mirena, so it was based for younger women who have never had children, because they have smaller uterine cavity and they have smaller cervix, so it was easy to put it in. But it was good for 3 years. The third one that came out is Kyleena, which is play on words with both Mirena and Kyleena. That one is again smaller than Mirena, had a little bit more hormone than Kyleena, and good for 5 years. So even the younger women could use an IUD which is good for 5 years. Then the fourth one currently which we have is called Liletta. So very similar to Mirena, the only difference is it is good for 6 years. It's approved for 6 years. So all these progesterone containing methods, the way they act is they do inhibit ovulation, but we see that even almost 50% of women who use this still ovulate. So the main action is by changing the cervical mucosa, making it thick so that the sperm cannot penetrate. And they also make the lining of the uterus very, very thin. So these are all our hormonal methods. I'll go over it: pill, patch, ring, then progesterone only pill, the shot, the Nexplanon, and the IUD. Now the non-hormonal methods are, there's also an IUD called Paragard. It's a copper IUD. So copper wire is wrapped around both the vertical and the horizontal arms of the IUD, which is released every day, and it also has effect on cervical mucosa. That way it prevents a sperm movement. The other non-hormonal methods are barrier methods like condoms, both male condom, female condoms, spermicide, and diaphragms. So they're not very effective, but they can still be used. And condoms are the only one which protect from sexually transmitted disease. None of these hormonal methods prevent actually sexually transmitted disorders. So this was a little bit of information. If you have any more questions, you can feel free to call us, make an appointment, or just reach out to us. And I'm hoping that you found this useful. Thank you.